Martinez with Department of Human Services. Of course, the purpose of this call, this is our regular kind of check-in call with you folks regarding the mass testing and the sentinel testing. I guess first, before we get started, Jana or Joey or Julie, any of the DD staff, do you have any updates or information you'd like to share with the group?
I don't, but I'll turn that over to Jana and Lisa if they have anything.
Yeah, I don't have any updates. I hope everyone was able to join the sentinel testing call that we had. The forms for registering for that are due September 15th. So if you have any questions on that, you can certainly shoot me an email and I can help answer any questions you may have on that. Some questions, we do have to work with the Department of Health and get answers to, just with our population and the residential settings that we have. Some of the questions can get a little bit complicated. So we are working through some of those, but just shoot me an email if you have anything and we'll get your questions answered.
Okay, thanks, Jana. And I don't see anyone from the Department of Health on the call today. So I think the thing to do is just to open it up to you folks to see if you have any questions again, primarily regarding, either the mass testing or sentinel testing or really anything kind of COVID related.
I guess one question I have that impacts CESDAC, at least, and probably more than just us, is we did our mass testing through LabCorp, and then through that sentinel testing conversation, there is encouragement that you continue your sentinel testing through the same people you did your mass testing through. So for us, that'd be LabCorp again. And as we reached out to LabCorp and pointed that guidance out, that was a shock to LabCorp. And they were, because they were under the impression that it all had to go then through the state for sentinel testing. And they committed to us that they were reaching out to you or to the state to figure that out. That's probably been 10 days, 2 weeks ago. And I don't know if we have more answers internally. Abby Parlett, our nurse, is on the call too. But I know at this point, we're not ready to start doing any sentinel testing because we don't know who it's going to be run through.
Nick, I can speak to that a little bit. I think originally the sentinel testing was going to go through the Department of Health, or that was kind of the original thoughts. And then that quickly changed with school starting and testing schools and things like that. So, with this whole COVID testing overall, things are changing like practically on a daily basis. So, we're trying to keep up with those as well and just work the best we can with the labs and things. But the 4 labs are the labs that will be using the 4 approved labs, which are Sanford, Avera, Monument, and LabCorp, are the ones that we'll be using for sentinel testing. Now, your sentinel testing forms are due September 15th, and then what the goal is to get everybody started kind of at the same time with the sentinel testing.
Hi there, Abby Perlett here with CESDAC. Yeah, that is accurate, Nick. I have not gotten a confirmation yet from LabCorp. The representative stated he would be reaching out to the South Dakota Department of Health regarding the billing for those tests. LabCorp said they are willing to help us out with the sentinel testing. but they needed confirmation that they could bill the South Dakota Department of Health or the health laboratory. Has there been any movement on that part yet?
So Jana, the confirmation, the billing process is going to be the same for sentinel testing as it was for mass testing. Is that your understanding?
Yeah, my understanding is that it will be the same, and we do have contact people at the Department of Health for each assigned to each lab for billing purposes. So if there is any questions regarding billing, shoot me an email and I will include in the email that Department of Health billing contact, just to help assist with any questions or concerns with billing.
Thank you.
Kind of on the same note, so we did contact the state lab yesterday per our conversation with you, Jana, and they were not very friendly to us when we talked about going through them. In fact, sorry to throw you under the bus, but they asked more than once about who Jana was and wanted her telephone number. So I don't know if you got a call on that, Jana, but I don't think they were happy to add us to the list for the sentinel testing.
Julie, do you know who you talked to at the Department of Health?
No, it was actually our LPN that made the phone call, but I was in the same room.
Okay. Well,
they weren't very happy.
yeah. Well, I don't know, there's specific people that we are working with this, with the Department of Health. The Department of Health is a huge entity with several employees. So hopefully you got to the right department or the right person. But if you have questions, I would say probably reach out to me and then I will direct you to the correct person at the Department of Health to visit with. That would probably be the best approach because there is a group of people specifically working on this particular project.
Sounds good. We will do that for sure.
Jana, this is Melanie. I think Ellen sent you an email this morning. She had a conversation with LabCorp this morning, and he said, Gary is his name, said that he had a recent conversation with the state of South Dakota Department of Health, and point prevalence testing would be covered by the state, but routine testing would be our responsibility. I don't know what that means. And then he also asked if we received any COVID funds to pay for this. I don't understand what that meant.
Okay, who was that email from?
Ellen.
Okay, do you want to just forward that to me? Can you forward that to me and then I can take a look at it?
Yeah, she did this morning.
Oh, she did. Okay, sounds good. I haven't got to it yet. I'll take a look at it and see if I can get a response to you. But I will say the Department of Health is covering the sentinel testing and the point prevalence testing as well. So if that answers part of that question for you.
I don't know what point prevalence testing is.
So Melanie, that would be if you would have a case in one of your facilities, and then you'd want to test the contacts of that case to see if there was virus transmission. So it's kind of like a point in time based on a confirmed exposure to a case.
Yeah, I didn't understand why he asked that. Ellen had let him know, we started our sentinel testing last week and they picked them up. And then she just said it was recommended that we should do 3 a week. Can you just pick them up every Friday? And then he went into this other conversation.
Yeah. So that, of course, that would be a different scenario than what sentinel testing is. Sentinel testing is just again, kind of random periodic testing. Of
Yeah,
course.
that's what we
Yeah.
told him. Okay, okay. I'll just let Jana look at that email then.
This is Pam. I probably just finished some of this point prevalence testing, which everything turned out to be okay. And looking at sentinel testing and some of the conversation we had with the person that it was Avera that just ran those tests, they're really questioning the sentinel testing just because of the turnaround time it took us to get all the tests back, which was 7 days. My question, I guess, a little bit is, we've talked about this and help me to remember, what's the expectation? Are we expected to do something weekly, every 2 weeks, every month? It will help me to get a clearer expectation of, or a picture of what we can and can do. Avera here in town can only run 20 tests. So they've said, we really can't help you. So we would have to go to LabCorp, which we are okay with. We really liked working with them.
So Pam, the recommendation for sentinel testing is that you would take 5% of your population and of asymptomatic individuals and test them monthly, or test them weekly, I'm sorry. And so that's kind of the recommendation from the Department of Health on how that would work. So ideally it would be a staff member and a participant weekly. It's going to depend on your population and the 5%, but that would be kind of the ideal scenario.
If we decide to do less than that, is that acceptable?
Less than 5%?
Less than weekly?
Oh, less than weekly. You know, really, I think it really is up to your agency on what you want to do, but there are, you know, specific recommendations that that were put in place. And so that's kind of what the Department of Health would like you to follow, or what they're recommending. But I think it really is ultimately up to your agency on what works best for you and your settings.
Okay, thanks, Jana.
Yep.
Jana, this is Jennifer in Aberdeen. I have a question. We've went through the mass testing but haven't started the Sentinel yet. We're, I think, getting some different guidance based on how to, when we've had a confirmed exposure, and as far as doing additional testing based on what those people that have close physical contact and where exactly the exposures lie based on what type of PPE they were wearing. My question is, you know, when someone's been asymptomatic, they've been wearing their face mask. We've been told at times when there's been an exposure that as long as they were wearing the face mask, if there had been some close contact, that was okay. And other times we're hearing that in the event that they did not have on a face shield, in addition to the face mask, that was the concern, and that really the physical distancing is the only thing that would be taken into context to eliminate that the close contact or the exposure, unless basically they were wearing that full PPE. And so I'm not sure what I guess that minimum standard is, if you know, it just seems like we're getting some new guidance or some different guidance, and maybe it's just us.
Okay. Are you getting that guidance from the Department of Health, or were you getting that guidance from?
Yes.
Okay. There is a specific, if you do have specific questions, or if you want to, maybe, do you have a concern that maybe you have a situation where there's a potential outbreak in your agency somewhere, or that there was a number of people exposed?
I don't know so much as that. It's just really frustrating that we're not getting what we would say in this situation, there's this guidance, and in a similar situation, there's different guidance. I don't know if it is the particular Department of Health staff are providing the guidance, and that we don't have always the consistency in the same staffer there that we're dealing with to provide us the guidance, or I'm not saying that there's a concern that we've got a new exposure, just that we're getting what appears to us discrepancies in guidance. And of course, that's really frustrating.
Okay.
Jana, this is Angela, sorry, the nurse here. It's a combination, I think, of concerns when and me just needing some clarification too on things I thought. I mean, based on the CDC guidance and the stuff specifically for the healthcare provider, stating one thing about the other person wearing a face mask or a fabric mask, and the healthcare provider wearing PPE, and it not going the opposite direction, and then being guided to go also look at the public health community in the opposite direction. So I think it's just some conflicting things and confusion, and then feedback based on our own circumstances.
Okay. Okay. Well, we can certainly, definitely sit down and have a call, and there is, I do have a specific contact at the Department of Health that's a public health infection preventionist that has been very helpful with the point prevalence testing and things like that. So we could certainly, visit with her if there's a specific concern with somebody, or if there's specific guidance that you guys are confused about or conflicting, we can definitely get clarification on that. So Angela, if you want to, or Jennifer, if you guys want to give me a call directly, we can definitely visit about that and get some clarification for you.
Yeah, I mean,
oh, sorry.
I was just gonna say that would be great, because I mean, and I think it's not just with the Department of Health. I mean, when you look at the actual CDC, the different guidelines, there's things that just conflict a little bit.
Yeah, I know it can definitely be confusing, and and then with like the different community spreads and things like that, it can get a little bit confusing and complicated. So yeah, we can definitely have a call and kind of walk through whatever is going on and get some clarification for you.
This is Shirley Halverson. Is the current definition 15 minutes of unprotected exposure, meaning no mask?
Not according to the CDC. And that's where we're having the confusion on the difference in what is considered when you look under healthcare provider and when you look under community, public health community exposure. They conflict a little bit.
Is there one for us?
I'm sorry, who's us or who's?
This is Shirley Halverson. I guess if there was one, I think we're going with the staff shortage guidelines for healthcare providers, and I thought it was a 15-minute unprotected exposure. I just think it might be easier if we all have one definition, and I think that's what you're asking for, but I'm just curious.
Yeah.
Well,
Shirley,
this-
I'm looking at it right now, and they're saying here, per the CDC public health guidance, that healthcare personnel should be following the risk assessment and work restrictions for healthcare personnel. However, such healthcare personnel should also be following the guidance for the community-related exposure for what to do in the community. And that's where there is this discrepancy relating to masks and all of that. And so I think that's what, while I appreciate, and we will certainly take advantage of the phone call to get like some of these specific questions answered, I think on these calls, we all have these like weird like questions, and I shouldn't say weird questions, they're legitimate questions, but I think some of us are just going, we're back to, I mean, I'm right now trying to figure out, well, the difference between surgical masks, facial masks, respirator mask. I mean, I'm reading this stuff and I'm like, boy, we've been doing this for months and I feel like I'm back at square one. And I'm just expressing my frustrations that, I mean, I think that I would hope that we could maybe, I don't know if we could utilize these calls to be able to have some of these questions and then get some answers out. And it'd sure be nice that we could have some guidance so we could all work on the same thing, that there's guidance that's out there, but anything that we can do, because we're all just really frustrated, and I'm trying to keep my nurse, I love you, Angela, from, falling off the cliff here. I mean, people are on the edge. This is getting a little crazy in some of our communities, and it's incredibly stressful. And if we can do anything to diminish the amount of gray that's out there in these guidelines and get it a little bit more black and white, considering our circumstances that I know are very, anyways, that's just me, and I'm frustrated. There's a lot going on in Aberdeen, and so we need some help.
Yeah. Well, yeah, we appreciate what you're saying, and sorry for your frustration. One thing maybe we can do, here's an idea, because what we can do is we can certainly line up and have health department folks on the call, but I think it would be most helpful if somehow we could get an indication of what types of questions you have so we get the right people. So maybe what we'll start doing is maybe a few days or maybe even a week prior to the call, maybe just by email poll you folks and find out what types of questions you might have, so we could have some of those folks, or at least attempt to have them lined up to participate in the call.
And this is Angela. I did type up and create that, and I also included and pasted all of the different CDC guidance and Department of Health guidance, and some conflicting stuff there, just like a one example of the confusion. And I'm going to say it's probably not necessarily all Department of Health issue. I mean, it's just the CDC guidance leaves room for some interpretation, I think, is the big thing. And some things can be not left or not included. The healthcare provider one says nothing about quarantine, isolation, like none of that, that's not even included in that document, or that you need to see this other document. I think it's just, there's so much out there that it's, see this, but then not for this circumstance, but then nope, not that thing there. Nope. I mean, it's like a lot of interweaving. According to the healthcare provider, they're not considered a, close prolonged contact, or shouldn't be, excuse me, if they were close prolonged contact, shouldn't be excluded from work. If the healthcare provider is wearing a respirator or face mask. And then it also lists if the healthcare provider is wearing eye protection, if the person with COVID was not wearing a cloth face mask or face covering or face mask. It doesn't say anything in there about if a person was tested negative, if they still need to quarantine, it doesn't, but no symptoms. There's a lot of things just kind of not there. But then when you go to the the other side of it with the public health, it basically says it doesn't matter if you were wearing full PPE. So, I mean, within all those documents just seems a little confusing, contradicting each other, and not quite fitting with our setting.
And Tom, thank you for that offer. I mean, what Angela's created and the few other questions that we have, I mean, we'll generate into that, into a document that we have for questions. And then if you would be so kind as to ask other providers for their questions as well. I appreciate the opportunity in the future to be able to have somebody on the call that could help us with those answers, or at least give us some guidance. Thank you.
Sure, absolutely. We're happy to do that. And my suggestion would be attempt to make the questions as specific as possible. I haven't combed through all of the CDC guidance. I'm sure there's contradictory guidance in there. I don't know if the South Dakota Department of Health is going to be able to clarify, contradictions within the CDC guidance. So if you can distill, I guess your confusion or narrow it down to exactly kind of what information you guys need in order to do your jobs, that would be helpful, because then we could try to get to the heart of the matter, as opposed to, just having a general kind of conversation about
I think the biggest
precise guidance.
Yeah, I mean, I think the biggest thing is we're just trying to figure out what is the recommended PPE or face mask for people supported, or what would reduce that being considered a close contact, because we're a lot of our cares are close. And so just kind of looking for guidance on what changes that, or how do we minimize that by wearing the appropriate PPE. And right now it's seeming like nothing, there isn't anything you can do. So I think that's just kind of what we're searching for.
I think there's Department of Health hosts calls every week for long-term care facilities, which granted we're community support providers and it is a bit different in our settings as compared to nursing homes, but those are every Wednesday and they're really helpful. They're archived on the Department of Health website, and there's a lot of good information that's presented in those, as well as the healthcare provider calls, which are on Thursdays. Jana is really good about forwarding out those links and that information. And so I think some of this general information is also covered. Granted, the healthcare partners is much bigger. It's labs and it's infection control, and it's very broad, but just to understand what's going on in the broader scope. And they also answer questions in both of those webinars. Those are really good avenues to send messages through chat and ask those questions, and also, get updates from the respective experts at Department of Health.
Yeah, and I have been participating in those. And sometimes it's hard to type a question and then try and have back and forth conversation when you're typing. But I will certainly look to see if there's something on their ones that they've saved and see who.
And again, this is Jennifer. My understanding when, because there was so many CSPs that were on those long-term care calls, and they did find such a benefit in the general information that was being presented. And I think when we'd requested to have these calls with just the CSPs was because we had lots of questions, and we had lots of participants on those other calls, and that we did really realize that we were so different in many of our circumstances that we needed more questions answered. That's where I'm just hoping that we could formulate a strategy to be able to get those questions. And maybe it's a matter of, I appreciate Tom volunteering to have the department ask for those, but even if Dan could be getting those for us or gathering that up and then just trying to streamline it a little bit to be able to send. I'm asking that of Dan. I don't know if he could do that, but maybe even trying to see if there's similar kinds of questions.
Jennifer, are you saying like, that we could gather all the questions and it would go, like be funneled through me and then I could get those to Tom and Julie and Jana, or is that?
Rather than us bombarding the department with all of our different questions, if it could just be gathered by you at the association and then sent for them to kind of sift through.
Well, I'm okay with that. I think that would be fine, it would hopefully streamline it. If that's okay with the department.
Yeah, we're okay with that. The one thing I'd suggest, though, I think we're scheduled to have these calls every other week. That doesn't mean you have to wait up to 2 weeks before you can get your question asked and answered. Jana's still your point of contact. So as these things come up, please feel free just to reach out directly to her. And then in between these meetings, we can certainly run down some of this stuff. But yeah, if they're more general questions or they just happen to coincide with, about the time frame that the meetings are going to be happening, we're happy to do it that way too.
Okay.
Yeah, I can certainly send out, a message to the association ahead of time and get those questions gathered. And who would be the best? Jana, should I email those directly to you, or who would be the best person department-wise to receive that?
Yeah, Dan, you can just send them to me.
Any other questions or comments?
Okay, well, hearing none, is it safe to say we can wrap for today? Our next meeting will be 2:30 Central Time on September 23rd. And so in the meantime, send your questions to Dan Cross and he'll gather those and send them to Jana to review and get back to you as soon as she's able to track down answers. But we will probably be able to address some of the things that came up today, hopefully at next week's meeting, and have a Department of Health representative with us as well. Friendly reminder, there is a retainer payment Q&A starting at 3:15. So we'll wrap this and give you all just enough time to maybe take a quick break and stretch your legs and hop right back on. Okay, thanks everyone.
Thank you.
Thank you.
Thank you.
Bye for now.